Okay, hello, welcome to Paper of the Week. My name's Steve Eddy and I'm going to be doing the Paper of the Week this week. And this week we're talking about drugs. Yes, drugs. Cannabinoid? Absolutely. We're going to be talking about drugs. So this paper is called Cannabinoid in Anxiety and Sleep, a large case series. So what they did in this particular paper was they tested certain people with certain drugs. And it's quite interesting because this is not a new medicine. It was first used by US physicians back in 1930s and then finally stopped using it in the 1970s when the federal government listed marijuana as a Schedule 1 substance. Party poopers. Anyway, so it was used quite heavily up until those 40 years there as a treatment. Now, what does it do? Well, as you probably know from seeing all the stoner movies, because I know nobody listening to this would ever have smoked a joint ever in their life. But you know, if you watch those movies, you know that people get really, quote, chilled out when they have these sorts of things. So chilling people out is actually possibly a use of medicine. And so they tested CBD, which is cannabinoid, and what they did was they gave it to people with anxiety and insomnia, and they wanted to see what happens. Well, what they did was they tested 72 people. And what they did was their anxiety score decreased within the first month in 57 of the 72 patients. In other words, about 80% of the patients had their anxiety reduced, and about 2/3 improved their sleep dramatically. And of course, CBD was well tolerated in all but 3 patients. And you might think, wow, that's a pretty good result. And it is a very, very, very good result because anxiety medication is fraught with danger. In fact, a lot of people who go on anxiety medication get worse. People, I've just been talking to Matt, who's behind the camera, and we were talking about how Valium is widely prescribed out there and is highly addictive benzodiazepine. And so this might be another option for this sort of treatment. Now, I don't care if it's from cannabinoid. I don't care if it's a drug. If it helps people, it helps people. And that's what I'm all about. So this helped. And what they did was in another trial, they actually compared it with nitrazepam, which of course is a sleeping tablet. And they found CBD was much better than the sleeping tablet for sleeping. So it's really, really good for working to help you sleep. And how does it work to help you sleep? They don't know. But they do know how it works to reduce anxiety. And CBD actually binds to the 5-HT1A receptor, which is the serotonergic reception in the brain. So it works like Prozac, but works very, very effectively. So in this particular study, they looked at it over a certain period of time and their anxiety levels dropped over month 1, month 2, month 3. The medicine was very, very well tolerated and there wasn't any addictive properties. Now, the problem with CBD is you can become addicted to the effect of it, but it's not as addictive as some of the other chemical addiction drugs are, like the benzodiazepines and those sorts of things. So this is a study, again, called Cannabinoid in Anxiety and Sleep, a large case series, and it was published this year, 2019, in fact in July. So it's a fairly recent paper. And I urge you to have a read through this because it goes through other research and other benefits. Now again, we don't sell it. It's banned in Australia, but hopefully there are trials underway for its use for pain, and maybe it can be used for anxiety and maybe helping people sleep. As I said, I don't care that it's got a bad name because people abuse the drug. People abuse the opioids too. But gee whiz, if I just came out of a surgery and I had to, have some major surgery, I would take opioid drugs to reduce the pain. So everything in their place. Now, would you want to use this long term? No. You want to treat the anxiety by doing healthy things, living well, exercising, eating well. But as a medicine, this is a good one. So look into it. And that's been Paper of the Week. Thank you.